Hey gang, touching base with another Good Fit Talk where we're going to discuss the role of the healthcare system in the health or lack thereof of America. And while it might seem like stating the obvious, the first thing we need to get straight is that healthcare is big business in this country. If you've ever been slammed with an out-of-network bill, you likely know what I'm talking about. But have you ever considered the possibility that part of the business model behind our healthcare system actually involves keeping people sick? To be clear, this is not some sort of conspiracy theory where I'm suggesting that the medical community is scheming to perpetuate illness. But there is no denying that when there are profits to be made off of illness, sickness, disease, that there's a corresponding lack of incentive to encourage people to get well. This is incredibly evident in the rise of Ozempic, which was previously strictly a diabetes drug and has now been approved to treat obesity in Americans as young as 12. And while I am not here to argue the legitimacy of certain individuals needing clinical support on their weight loss journey, what I do think is glaringly absent from the conversation are the indisputable benefits of a balanced diet and exercise that are going to be lost when we resort to treating weight loss with a drug. Because unfortunately, in this country, the primary carrot on the stick that has always been used to get people to move has been a shrinking waistline. So if you take that away, if it's no longer necessary, if you offer people an easier way out, you can guarantee they're going to take it and pay for it. And I can also tell you from firsthand experience that children who don't learn to love to exercise turn into adults who don't either. So these prescriptions have far-lasting side effects that basically guarantee dependency and pad pockets for years to come. So the question I keep coming back to is, how are we as a nation so insanely far behind the rest of the world in understanding that diet and exercise result in so much more than better, improved aesthetics? Well, part of the answer has to do with a healthcare system that prioritizes profits, and the other part has to do with the raw truth about my industry, the world of fitness. Stay tuned.